Carotid triangle. It is so called because all the three carotid arteries, that are the common carotid artery, external carotid artery, and internal carotid arteries, are present within the carotid triangle. The carotid arteries are very superficial in the carotid triangle. First, we will discuss about the boundaries of carotid triangle. The boundaries are antero-superior, antero-inferior, and posterior. Antero-superiorly, the carotid triangle is bounded by posterior belly of digastric muscle, and it is supplemented by or supported by the stylohyoid muscle. Antero-inferiorly formed by a one muscle that is called as a superior belly of omohyoid, and anterior border of sternocleidomastoid muscle forms the posterior boundary of the carotid triangle. The carotid triangle is bounded antero-superiorly by posterior belly of digastric muscle and stylohyoid muscle, and antero-inferiorly by the superior belly of omohyoid muscle, and posteriorly by the anterior border of sternocleidomastoid muscle. The next boundary is the floor of the carotid triangle. The floor is formed by the four muscles. The first muscle, that is the hyoglossus muscle, and thyrohyoid muscle, that is placed anteriorly within the carotid triangle. And the another two muscle is the middle constrictor muscle and inferior constrictor muscle, that lies posteriorly within the carotid triangle. The boundaries are antero-superior, antero-inferior, and posterior, and floor. Antero-superiorly by the posterior belly of digastric muscle and stylohyoid muscle, and antero-inferiorly by the superior belly of omohyoid, and posteriorly by the anterior border of sternocleidomastoid. And the four muscles forming the floor of the carotid triangle, that is the hyoglossus muscle, thyrohyoid muscle, middle constrictor muscle, and inferior constrictor muscle. Next, about the roof of the carotid triangle, that is formed by, first one is the skin. Just below there is the superficial fascia with the platysma. Deep to the superficial fascia, there we can see the investing layer of deep cervical fascia. That's all about the boundaries of the carotid triangle. The next one, that is the contents of the carotid triangle. The first content is the bifurcation of common carotid artery. This one is the common carotid artery. The upper border of the thyroid cartilage. The common carotid artery is divided into two: external carotid artery and internal carotid artery. The internal carotid artery lies posterolateral to the external carotid artery. At the level of bifurcation of common carotid artery and the adjacent to the internal carotid artery, there is present a small swelling called as carotid sinus, that is supplied by the glossopharyngeal nerve. And this carotid sinus that acts as a baroreceptor for controlling intracranial blood pressure. There is another structure present related to the bifurcation of common carotid artery, is called as a carotid body. That is a small neurovascular structure situated close to the posterior wall of carotid sinus. This carotid body that acts as a chemoreceptor for controlling the oxygen tension. The first content of the carotid triangle is the bifurcation of common carotid artery. This one is the common carotid artery that they divided into external and the internal carotid artery at the level of upper border of the thyroid cartilage. The next content, that is the internal jugular vein. It is located lateral to the carotid artery in the carotid sheath. Here, this one is the internal jugular vein that is located lateral to the carotid artery. The carotid arteries are lies medially and the internal jugular vein lies laterally within the carotid sheath. In this carotid triangle, the internal jugular vein receives the three tributaries, that is the superior thyroid vein, common facial vein, and lingual vein. That's all about the internal jugular vein. The next content is the within the carotid sheath that we can see the posteriorly, that is the vagus nerve. This one is the vagus nerve. It runs downward inside the carotid sheath lying posteriorly. In this triangle, it gives a two branch, that is the pharyngeal branch of vagus nerve and the superior laryngeal nerve. The superior laryngeal nerve that is divided into two, external laryngeal nerve and internal laryngeal nerve. So that's all about the contents of carotid triangle within the carotid sheath. Common carotid artery, internal carotid artery, then internal jugular vein and vagus nerve. The next content that is the spinal accessory nerve. The spinal accessory nerve crosses the posterosuperior angle of the carotid triangle and it enters into the sternocleidomastoid muscle. So this one is the carotid triangle. Within the picture, we can see this one is the spinal accessory nerve that lies the posterosuperior angle of carotid triangle. Then it is entering into the sternocleidomastoid muscle. The next content that is the hypoglossal nerve. It enters the carotid triangle that is lies deep to the posterior belly of digastric muscle. So this one is the hypoglossal nerve that entering into the carotid triangle that is lying deep to the posterior belly of digastric muscle. Then entering into the carotid triangle, it lies in between, first of all, it lies in between the internal jugular vein and the internal carotid artery. Then this nerve crosses superficially the internal carotid artery and external carotid artery. Then it forms a loop around the lingual artery from lateral to medial side. In this triangle, the hypoglossal nerve gives off superior root of ansa cervicalis and a one branch to the thyrohyoid muscle. The next content of carotid triangle is the nerve that is called as the ansa cervicalis. The ansa cervicalis, it is a loop-shaped nerve plexus with the root value C1, C2 and C3. So this is the nerve loop and this is called as the ansa cervicalis. The C1 fibers from the hypoglossal nerve that forms the superior root or descent hypoglossal. This is the superior root. And this one is the inferior root that is arising from the C2 and C3 fibers joint and this is called as the descending cervicalis. And these two roots, the superior root and the inferior root that join together to form the ansa cervicalis. The loop of ansa cervicalis that is supply the three muscles that is the sternohyoid, sternothyroid and inferior belly of omohyoid. This ansa cervicalis that lies on the anterior wall of the carotid sheath. And the branch from the superior root that is supply the superior belly of omohyoid. That's all about the nerve present in the carotid triangle. The nerve present in the carotid triangle are the vagus nerve. Within the carotid triangle, vagus nerve mainly give a two branch, that is the pharyngeal branch and the superior laryngeal nerve. Again, the superior laryngeal nerve divided into external laryngeal nerve and internal laryngeal nerve. The another nerve that is the accessory nerve and the next one is the hypoglossal nerve and next one that is the ansa cervicalis. The last nerve related to the carotid triangle is the cervical sympathetic trunk that is lies embedded within the posterior wall of carotid sheath. And it is the nerve related to the carotid triangle. And the another one, the lymph node related that is lies in the content of the carotid triangle are the jugulodigastric and jugulo-omohyoid. The next content of the carotid triangle that is the branches arising from the external carotid artery. We know that 8 branches are arising from the external carotid artery. Of that, the 5 branches is arising within the carotid triangle. The 5 branches are this one is the ascending pharyngeal artery. This one is the superior thyroid artery. And this one is the lingual artery. And this one is the facial artery. And this one is the occipital artery. The first one that is the ascending pharyngeal artery. The ascending pharyngeal artery is the first branch of the external carotid artery. It ascends between the internal carotid artery and the pharyngeal wall. So this one is the ascending pharyngeal artery. This is the first branch of the external carotid artery. It ascends upward between the internal carotid artery and the wall of the pharynx. The second branch is the superior thyroid artery. This one is the superior thyroid artery. It is the first branch of the external carotid artery that is arising from the anterior aspect. It gives the infrahyoid muscle branch and superior laryngeal and a sternocleidomastoid branch. So this one is the superior laryngeal branch. The superior laryngeal branch is accompanied by the internal laryngeal nerve, and it pierces the thyrohyoid membrane and entering into the larynx. The superior thyroid artery is accompanied by a one nerve that is called as a external laryngeal nerve. This one is the external laryngeal nerve. Then the third branch that is called as the lingual artery. That is called as the lingual artery. The lingual artery is arising from the anterior aspect and behind the tip of greater corn of hyoid bone. So this one is the lingual artery. The lingual artery is also arising from the anterior aspect of the external carotid artery and behind the greater horn. This one is the greater horn of the hyoid bone. And it form a loop around the greater horn of hyoid bone, and the loop of lingual artery crossed by a hypoglossal nerve. And this lingual artery passes deep to the hyoglossus muscle. This muscle is the hyoglossus muscle. And the next one, that is the facial artery. This one is the facial artery that is arising from the anterior aspect of the external carotid artery, that is arising just above the origin of the lingual artery, and it leaves the carotid triangle by passing deep to the posterior belly of digastric muscle and entering into the digastric triangle. That's all about the facial artery. The last content of the carotid triangle, that is called as the occipital artery. The occipital artery, that is origin at the level of facial artery. So that is lies just opposite to the facial artery, that is arising from the posterior aspect of the external carotid artery. It passes upward and backward under cover of the posterior belly of digastric muscle, and it gives the two upper and lower branches that is supply for the sternocleidomastoid branch. So that's all about the contents of the carotid triangle. The contents of carotid triangle are the bifurcation of common carotid artery, then internal jugular vein, vagus nerve, ansa cervicalis, accessory nerve, sympathetic chain, jugulodigastric and jugulo-omohyoid lymph node, and 5 branches of the external carotid artery. The 5 branches of external carotid artery arising within the carotid triangle are the ascending pharyngeal artery, superior thyroid artery, lingual artery, facial artery, and posteriorly by the occipital artery. The clinical anatomy related to the carotid triangle, that is the first one is the carotid pulse. Carotid pulse that can be feel within the carotid triangle because here is presented 3 carotid artery and the 5 branches of the external carotid artery. Because of this massive arterial pulsation is felt here to a palpating finger, and hence it is preferred site for taking carotid pulse. The second one, the importance of the lingual artery. The loop of lingual artery above the greater corner of hyoid bone is an important landmark for the ligation of lingual artery during the time of flossectomy. And the last clinical aspect, that is the painless enlargement of deep cervical lymph node along the internal jugular vein due to the tuberculosis is quite common. So that's all about the carotid triangle.